Hi everyone, welcome to our Nanit IG Live that we are going to be hosting in collaboration with Solid Starts, and this IG Live is Sleep and Starting Solids 101. So I am just going to join us, and hopefully Kary will be joining us soon. And if you are new to us, hey Kary, how are you?
Hi, I'm good. How are you doing?
Great, I'm so happy that you jumped on. I just wanted to mention to anyone if they wanted to just pop in the chat where they're from. It's a great place for us to start. Um, we're so excited that you can join today. We know that sleep and two of the things that you really have a hard time with, and really like some support and guidance around. So I'm so excited that you can talk to us today and debunk myths around starting solids. I'm introduce myself, and then I would love to introduce yourself. My name is Dr. Natalie Barnett. I am clinical research here at Nanit. So I am a science training, and I am the mother of 3 boys and live in New York City. So, and Kary, I'd love to hand it over to you to introduce yourself as well.
Absolutely. I'm Kary Rappaport. I'm a pediatric occupational therapist and a lactation consultant by training. I specialize in infant feeding, eating, and swallowing. I've been doing this for almost 20 years. So I have a long history of working with little ones, everywhere from birth through around 5 or 6 on feeding, eating, and swallowing issues. I worked for many years in a NICU, so I worked with medically complex and fragile children as well as children who are more typically developing and healthy. And then I have 2 children of my own.
Amazing. Beautiful. Thank you. Thank you. I appreciate that. And one thing that I mentioned at the outset is that anyone who is joining or anyone who signed up to join can use our code NANIT at Solid Starts to get a discount off. Actually, what do you get? A discount off your first year of Solid. It's a great discount. So thank you so much for that. And also, too, if you are a Solid Start, a code on .com, which is Solid Starts 20 to receive any full priced items on nanit.com. So I just want to get those 2 things out of the way before we started. And because I know everyone is really excited to hear from you, Kary. And I wanted to, and look, we know that starting solids causes, so much anxiety for new parents, as does sleep, to be fair. And then combining those 2 things together can be very stress provoking for new parents. And so I would love to just start by talking a little bit about how you think about starting, a solids journey for parents, and what do you typically recommend in terms of when do you typically recommend that they start solids, and B, what sort of foods do you typically recommend that they start with?
Yeah. Great questions to start with. So usually most babies have a set of developmental skills that shows up around 6 months old that tell you they're ready to start solids. So that's not all babies. Some babies may show you those signs as early as 4 months, although that's more rare. And some babies, it may be a little bit after 6 months, but it's usually around 6 months according to the research. And the set of skills that we're looking for in a baby to say, yeah, I'm ready, bring me to the table, I can start exploring solid foods, are the ability to sit up with some pretty good trunk control. They don't have to have perfect balance at first, so a baby might wobble and tip if you let go of their hips. But if you hold them at the hips or their trunk, they should be able to keep their body pretty upright. You don't want to see a curved spine where they're falling forward. You don't want to see their head coming forward. You want them to be able to hold their trunk up. That's 1. 2, you want them to be able to use their shoulders and their hands to reach out and grab food and bring it to their mouth. So some young babies as early as 4 months can actually sit pretty well, but they'll prop sit. They'll use their hands to push against the ground, and they don't really have their hands free to explore things. That tells you they don't quite have enough stability in their trunk to be able to explore solid foods yet. So when a baby can lift their hands, reach out and grab things, pick them up, hold them, and potentially bring them to their mouth, that's a great sign that they're ready to explore solids. And then the third thing that we look for is interest. And usually if those first two are in line, interest is very quickly behind those two. So usually once the baby can sit up, reach out and grab, they'll start really looking around for things to reach out and grab. So they'll look at what you're eating, they'll watch you eat, they'll show an active interest in the food, and when you put food in front of them, they automatically reach out, grab it, and try to bring it to their mouth. So those are really the three key features we're looking for. And like I said, most will show up around 6 months old for babies. Again, a little bit later, a little bit sooner for some babies. We try not to look at age quite as much as we do those developmental signs. And then in terms of which foods to start with or what you should do when you get started, there's kind of a range. So you can choose which approach feels most safe and comfortable to you and your family. So some parents prefer to start with purees and go really slowly with some spoon feeding. Some parents prefer to jump right in with finger foods and kind of skip the spoon feeding and purees. You can do either. Both are effective, both work. Either one is fine, especially if it makes you feel comfortable. You don't want to choose an approach that makes you feel nervous or scared at the table. And then in terms of which foods we're starting with, we want to look for nourishing foods, but really truly we want to look for foods that you love, foods that are in season, foods that are available to you and your family, and share them with baby. People often ask what the best first food is, and there is no best first food. There are hundreds of great options for first foods. And again, we want to try for as nourishing as possible foods, but we also really want to bring baby in from the start to the foods and the flavors that the family eats, because the earlier they're exposed to those flavors and those foods, the more likely they are to eat them and then to continue eating them through childhood and beyond. So there are lots of options for that, and that's where our app comes in extreme handy, because there are so many foods. We have over 400 foods in the app that are excellent choices for baby and that show you exactly how you can cut and prepare the food for baby at different ages. So if you're starting at 6 months, it'll show you options for how to prepare the food safely for baby at 6 months. If you have an 8-month-old or 9-month-old or a 12-month-old, even 15-month-old, it'll give you options for how to safely serve that food to baby at all those different ages and in a way that you can progress their oral motor skills and help them learn how to join the family meal.
And I think it can be really overwhelming for parents, Kary, to just start that journey and also to then kind of get stuck in kind of what works. Okay, I've given them avocado and avocado works, so I'll just keep giving them lots of avocado. And I think it's really nice to have a tool like yours where you can just be giving them lots of different ideas about all the different things that they could be trying, because we want them to be trying lots of different flavors and textures and all sorts of different foods, right?
Yeah, I love that, Natalie. I feel like that's so important, both of those things that you said. That many parents worry that they have to do it perfectly and that they're, not sure where to start and they want to get it just right. And so I like to reassure parents, babies are so resilient. If you get stuck for a minute on avocado, it's fine. We want you to move past it, but babies can handle that and then, shift when you're ready to shift. So it's okay if you're not sure where to start. It's okay if you've made some mistakes. It's okay to start and then stop for a few days and be like, it's too overwhelming. And then I'm going to get back to it in a few more days. All of that is fine, because babies are very resilient and flexible. That said, on the flip side of what you said, I also love, which is just we really do want baby to be exposed to a wide variety of foods and flavors and textures across that first 6 to 12 months. It's a really important time, according to the research, where babies are most open to exploring those foods, flavors, and textures. And the more you introduce them to those variety of flavors and textures, the more likely they are to accept those foods beyond infancy, so in toddlerhood and in childhood.
Amazing. And one of the things that I hear a lot is that, oh, great, my baby's going to start to sleep through the night now that I've started solids. And so that's one of the sleep myths that I wanted to debunk, and I would love your input on that. Oh, we know that starting solids doesn't necessarily mean that your baby is going to be sleeping through the night. It very often happens at around the same time. Most babies start to be capable of sleeping through the night at around the time that they start solids. But it doesn't mean that just because you start solids is going to mean that they start to sleep through the night. So and them sleeping through the night really, it's a combination of things, but it's very much dependent on, ensuring that they're getting enough to eat during the day, whether milk or milk and or their solid feedings, but also to ensuring that they're capable of falling asleep by themselves at the beginning of the night is really going to help get them sleeping through the night as well. So do you have any but one thing that I would love to ask though, Kary, is there anything that you would say around starting solids and sleep, and in terms of sleep being disrupted when people start solids with their babies?
So a couple of things came to mind. Just one is that as you're talking, it just really made me think that sleeping and eating are just such complex skill sets. So there's lots of things that go into a baby being able to go to sleep, stay asleep, get up at the appropriate times. And their same goes for the baby being able to chew a wide variety of food, eat a wide variety of foods, share in the family meal, and to be an exploring and eager eater. So those are really complex skill sets. And while it's true that babies can sleep through the night around the same times that they're starting solids, many don't. And we know that it really is not due to solids. The research is very clear on that. It's that babies are particularly adept at breast and bottle feeding by around 6 months because they've had substantial practice across those first 6 months of life to get more efficient and to get into a really good rhythm of eating, where they may be able to start taking insufficient amounts of milk feeds during the day in order to go straight through the night without needing additional milk feeds. The solids are the icing on the cake at this point. When you first start solids, baby needs ample time to learn that complex skill set that I was just talking about. It's not like they start and then they're eating solids. It's more like they take that first wobbly step, and it takes them a long time to be able to walk a mile next to you on a walk around the neighborhood. They take that first piece of food, and it's going to take them months to be able to actually chew it, to successfully swallow it, and then to eventually eat a full meal with you. So we often say, oh, well, bring the baby to the table for one meal. And I think some parents think, oh, well, my baby's going to be eating a full meal at the table. Maybe I'll take away a milk feed at first. No. That is not the case. Yeah. You may not get a single bite of food into your baby's belly for the first month or two of starting solids because they're just playing. It's really a time for skill building. So we don't expect the solids to support sleep, and the research shows that they don't necessarily support sleep, even when you're spoon feeding, even with there was a common practice, I don't hear it as much anymore, but there was a practice of putting purees or rice cereal into the bottle to try and help baby to sleep better. That is not recommended, and it wasn't effective. Even if you wanted to try it, it's not even an effective strategy. So we don't recommend something like that anymore because we know it's about the milk feeds.
I love that. And one thing that I just wanted to mention too was that we have built on nanit.com our sleep schedule generator, which was designed specifically for parents who were having trouble thinking about, when do I give my milk feed versus a solid feed, and how much are they needing to eat during the day, so that we can then sort of move towards independent sleeping at nighttime or sleeping through the night without needing a feed. I think it can be very stressful for parents who are starting to ramp up their solid feedings, to make sure that they're not cutting back on those milk feedings too fast, right? Like when they're starting solids, to your point, milk is still the most important thing for your baby, and will be for a long time, right? And you can talk more specifically to sort of for how long, but we really took that into consideration when we were designing our the sleep schedules, because we know that it can be overwhelming for parents when they're thinking about, oh gosh, I'm worried I'm not giving my baby enough milk, or I'm worried I'm not giving my baby enough solids. And so we sort of created the schedules so that, if you follow the schedules, your baby should be getting the right amount of milk and the right amount of solids throughout the day, so you can work towards, sleeping through the night without a feed, because we know that there's so much information out there, for new parents, and it can be completely overwhelming. And we want parents to be confident in their parenting journey, and particularly in their sleep and feeding journey. And that sleep and feeding are, to your point, so tied together. So we have this sort of free tool on our website that if anyone wants to use, they're welcome to just to use it for free, and I would love any feedback on it. But to your earlier point, Kary, I wondered if you could talk to thinking about those first foods. Are there any foods that you recommend that would promote sleep? And I'm hoping this is going to be another myth.
Yeah, so there are not any research-backed foods that are going to help your baby to sleep better. And unfortunately, the skill set to eat those foods is so much more important at this point that we want to introduce baby to a wide variety of foods. So even if there was a magic bullet food that was going to help your baby sleep, we would not recommend you serve it all the time to baby, because we want baby to explore other textures, other flavors, other colors of
Yeah.
foods every day. So no, there are definitely foods out there that are easier for baby to chew and swallow pretty quickly. So if you think about foods that are really soft and mushy, like a banana or an avocado, oftentimes those foods, if you're mashing them, baby can ingest a good amount of those foods pretty early on, which might help get a little bit more food in the belly and make you feel like it's a more successful meal, but that doesn't necessarily contribute to increased sleep or better sleep. And as a matter of fact, sometimes when you start solids, your baby's digestive system can get a little disrupted, and that can disrupt sleep, even though they're on the right track, even though you're introducing the right foods and doing it all correctly. Sleep is just complex and a little bit challenging, just like starting solids is a complex activity.
And also to that point, I think it's important for people to know that, it can be, a little bit disruptive for their digestive systems. They could be just a little bit uncomfortable during a night, which might, disrupt their sleep. And so I think it's important for folks to just really know that this is a journey. It takes time. Your baby's not doing anything wrong, but there's lots of things that can disrupt sleep.
Totally.
Your
I
baby.
want to just add on, you made me remember that as a lactation consultant, I was an IBCLC before I had my first
Yeah.
baby. And as a breastfeeding promoter, I was very much in support of letting baby feed on demand and being very loose with my schedule and being, very go with the flow of following baby's lead. And then I remember having my first baby and feeling so lost and feeling so confused on what I was supposed to be doing with my day and how it was supposed to flow and when I was supposed to be doing different things, that when a friend had recommended a schedule, I like latched onto it immediately. So I was like, I just need something to anchor me. I know I can adapt from here to follow my baby's personal needs and my family's personal needs, but I needed somebody to give me a little bit of guidance around where I should start. So even if you feel like a schedule is not something that's for you because you use more of like a daily rhythm and you follow baby's leads and you're very strongly pro feeding on demand, still knowing kind of some general frame of a schedule can be really helpful to guide your day so that you feel not like a crazy person.
Yeah, and that's exactly what we would say too. That schedules are really just are a guide for you. We're not at all saying that your baby needs to be asleep at 10:01 and will be waking up at 10:59. Your babies are going to be, depending on their day and depending on a whole variety of different things. They're going to be, their nap systems will be that they maybe they may be ready for a nap a little bit before the schedule says, or a little bit after the schedule, or hungry before or after, and that's totally fine. Your baby's not a robot. Your baby is, you do need to sort of move, go with the flow,
Yeah.
somewhat. But that said, that schedule is sort of a nice, anchor and, a nice guide for you, so that you can move towards a place where your baby is getting all of their calories that they need during the day, so that they then don't need to be eating overnight, which is, a goal for lots of parents. It's not a goal for every parent, and that's fine too, but it is a goal for lots of parents. But there was one other thing that I wanted to ask, and I know that I can see lots of comments in the chat, and we see, we know a lot of people are very curious about introducing or B, if your baby does have an allergy to something, whether it be, dairy or soy or something, how do you navigate those? And so if you can start with the first question and then move on to the second, that would be great.
Totally, yeah. there's been a lot of change in terms of how we introduce allergens to babies over the last 10 years. So if you happen to have an older child and a newer baby, you might have heard that it was done differently before. So now we know that the research is pretty darn clear that we want to introduce allergens early, which means around the time you start solids. Before, we would recommend that the allergens, and really there are 9 most common allergens. While a person can be allergic to any food out there, the vast majority of food allergies are to the same 9 foods. So it's wheat, shellfish, shellfish, finfish, dairy, egg, soy, sesame, peanuts, and tree nuts. Those are your 9 common allergens that your baby is most likely to develop an allergy to if they were to develop an allergy. Those are the ones you want to introduce early, around the time you start solids. We don't recommend it be your very first food, but somewhere in the first few weeks, you want to start introducing one of those common allergens at a time. And we often say, so another recommendation that was a myth previously was introduce one food for 3 days, then move on to the next food for 3 days, and then the next one. That really slows how quickly you can introduce food variety. So instead, what we recommend is that you introduce lots of foods over the course of a week. It does not have to be one food. You can introduce 2 foods at the same time, as long as they're not common allergens.
Got it.
So the only exception to that is we want to introduce those common allergens, ideally one at a time, just so you can see if there's any response to those foods. So you introduce them, we often recommend in the morning, then you have all day to watch for any particular allergy signs, although usually you'll see them within a couple hours, an hour or 2 of eating. So it's usually don't need the whole day, but it's good to have it just in case you need to get to a doctor. And then keep introducing those common allergens. So once you introduce egg, for example, or a little bit of peanut butter, you're not done. It's not like a one and done situation. So if your baby doesn't have a reaction, that's perfect. You just want to keep it in the rotation, ideally a couple times a week. So you don't have to get stuck on that food, and you don't have to introduce it by itself on subsequent introductions. You can introduce it with other foods. So you could do, you know, a little bit of peanut butter thinned out on your finger the first time, and the second time you might put the peanut butter mixed into something else, you know, yogurt or on a banana or something, and that's just fine, or on an apple. Right. So that is how we would introduce the common allergens. There is a subset of babies who are at high risk for developing food allergies. For those babies, it is generally the strongest predictor of that is that the baby has severe eczema. It's also another risk factor is that baby is proven allergic to another food. So those are your 2 things that put you in that high risk category. There was some thoughts around having a family history of allergies, but that doesn't actually seem to be one of the biggest risk factors. It's really those 2. If your baby has those high risk factors, you will want to speak to your doctor about this, but there's some literature that suggests you might want to get started a little on the earlier side as soon as baby is showing some really good readiness signs, but you may do small tastes of some of those allergens a little earlier, like say 5 months instead of 6 months, just to start building baby's tolerance to those allergens early, as long as baby is interested and happy to accept those. If they're not, you just wait till they're showing readiness and then you get started. I think that's all the pertinent details around introducing the allergens. If you're
just to ask a question on that, can you a little bit of guidance around the best, like you said, perhaps a swipe of peanut butter on your finger or on avocado or in with banana or something. Can you give us some other examples of ways to introduce those allergens? Like, do you scramble an egg and then sort of puree in with your sweet potato, or like do you cook the egg some other way, or do you cut it up? I would love some guidance on. I think people would love some sort of tips around sort of the best way to introduce specific allergens.
Yeah. Those are great questions. We have an allergist on our team who is world renowned. She is a phenomenal allergist. So I will just caveat this by saying I'm not an allergist, so I don't want to like completely lead anyone astray. We have a lot of great tips on our website. If you like, for example, look up egg, you'll have a whole slew of information and recipes and suggestions for how to introduce these things. Same with peanut butter. But I do want to say we recommend low and slow. So instead of, a big spoonful of peanut butter, you're going for just tastes, like small amounts at first. And when it comes to egg, we often recommend, scrambling into, and you can cut it into strips, but then letting baby, if you let a 6-month-old baby kind of explore an egg strip like that, they're not actually going to be able to chew and consume much of it. They're going to mostly get flecks and flavors of it rather than a large amount of it. So you can introduce it like that, or if you're nervous, you can do tiny little bits of the egg mixed into other things like yogurt, or actually yogurt would be not a great one unless you've already introduced it, because it is not also a common allergen. So you might mix that into, say, mashed beans or something like that.
Yeah. Amazing. Okay, great. So it's a really great tip that your website is just so rich, and there's so many sort of tips and ideas, tricks of things that how people can be introducing those allergens. But it's just really is fascinating how things have completely changed in the last 10 years or so. So I'm just so happy to hear you talking about it. It's amazing. I wanted to talk a little bit about you move sort of a little bit earlier and talk a little bit about breast and bottle feeding, actually. So do you have, think about bottle feeding in particular, do you have any positions or techniques of feeding that you think are going to be able to, ways to minimize a baby's discomfort, for example?
Like in terms of like a gas and things like that,
or is it not something that they should even be worried about?
Yeah, I mean, I think, again, this is also baby specific, and it often has to do with how they're latching and the fit with the baby and the nipple. So baby with mom's breast or baby with the bottle nipple. So a few things that come to mind are less about positioning and more about, some babies need a progression of a nipple flow rate as they get a little older. They need sometimes even a different shape of the nipple as they get a little older. So newborn babies, especially ones that might even be born a teeny bit premature or in that full term but early, like 37 weeks as opposed to 40 weeks, can sometimes have very, very tiny little mouths. And as they grow and spread and get a little bit bigger, that little tiny little nipple that was a great fit for them now suddenly might not be as good of a fit. They might benefit from having a wider base nipple or something a little larger. So the fit with baby and the nipple is important. And if you hear clicking, or it seems like they're getting in a lot of air, or they're really gassy, those can be signs that you might want to play around with your bottle nipple just a little bit. And then when it comes to breastfeeding, it's really, again, dependent on baby's latch at the breast. So working with a lactation consultant can be really helpful. Sometimes using a nipple shield to get baby a really good latch on the breast can be helpful at first. A laid back position where you are partially reclined, and then baby is almost like a little bit more laying on top of you, almost on their belly, as opposed to leaning forward where they're on their back, can sometimes be helpful in terms of controlling air coming in as they're eating. And sometimes it's about the flow rate of your breast. So if you have a really strong letdown and baby is gulping in, trying to keep up with it, and they may be gulping air, you may need to deal with a flow or like a engorgement issue that needs to be addressed first. So there's kind of lots of things that play into that. I wouldn't say there's like a perfect position that is, universally going to improve comfort with breast and bottle feeds.
Okay, excellent. Thank you. And I'm sorry that I didn't get to that question earlier and that we moved on to solids for that. But this conversation has been amazing, and I'm so grateful to hear all of these tips and all of this amazing information. And I just wanted to remind everyone that anyone who is a Solid Start customer can get a 20% off coupon at nanit.com, and that would be Solid Starts 20. And any Nanit customers can go to the Solid Start app and get a 20% off Solid Starts, and that code is Nanit20, and I think that will be in the chat. But in terms of final comments or last things that you wanted to add, Kary, is there anything you wanted to say before we sign off?
If we missed your question, I did not get to it. Like Natalie said, our website is very robust. We have a pretty strong search term. We have a team of experts who have worked very hard over the past 4+ years to write articles, to put together lists, to put together information that is top-notch, designed by and run through a team of multiple experts. So please go to the website, search for what you need. Very likely you will find it. If you are not finding it, DM us. Go to our Solid Starts Instagram. You can send us a DM, mention today's live, and ask your question. We're more than happy with a team that's very good about responding and trying to set you in the right direction or give you resources so that you can find what you need.
Oh, that's incredibly helpful. Thank you. And also, too, I just wanted to mention that Kary is going to be one of our amazing speakers at our Parent Like a Pro Summit, which will be in September. So you'll be able to have the opportunity to ask more questions then. And we'll be sending out more information about our Parent Like a Pro Summit, in the coming months. So we're super excited that Kary will be joining us for that as well. But I just wanted to say a huge thank you to you for joining, and there was just so much amazing information. We're really grateful, and I think we can sign off and let people get on with their days. And thanks again.
Thank you, Natalie, for sharing your expertise as well.
Thank you. Bye.
Bye.